health workers will have their hands full attending to various injuries at hospitals. The public health sector experienced numerous challenges in the past year, from water and food supply issues to load shedding. According to reports, more than 150 healthcare workers were allegedly assaulted in public health facilities over the last 2 years. And I'm now joined by Simphiwe Gada, Gauteng provincial chairperson of the Democratic Nursing Organisation of South Africa, to speak about these attacks. Simphiwe, appreciate your time. Thanks so much for coming on to
Thank you for having us.
Newzroom Afrika. Now, let's talk about these challenges that you've faced, these attacks. Close to 150, I think, is what we've reported. And obviously, 150 is too many.
Yes, that's too many and unacceptable. And actually, when we look globally as well, about 38% of the health workers are exposed to, violence, whether verbally or physical, violence. And this is totally unacceptable. But when we zoom into South Africa and we look at the Health Act, it tells you that, health workers have got the right to refuse to treat any person that shows aggression towards them. But one thing that we must commend is that our health workers, have always, looked at the oath that they've taken, in that they sacrifice their lives in the pursuit of assisting the public who require healthcare services, because these health workers who are dedicated understand that the constitution of the country, provides that everybody must have access to healthcare.
So let's talk about the festive season, the period that we're in currently. What are the numbers there? Has there been a surge in these attacks?
Well, we have seen a surge in these attacks, especially at your community healthcare facilities and as well as your emergency areas where people, before you enter any health facility or a hospital, you've got to be admitted, you've got to be seen in the emergency area. That's where we have seen most of these attacks happening. And largely, these attacks are influenced by the usage of alcohol in the main. But also, what we have seen is a general decline in the moral fiber of South Africans, in that they do not respect healthcare professionals. And this is what we have been saying, that South Africans need to re-examine how they approach healthcare workers. Now,
from what we understand, the numbers are obviously seemingly a lot higher in the public space. Is it similar in the private space? And if not, what is the difference? What is the cause of that difference?
Well, you'd understand that 14% of the South African population relies on the private healthcare service, and most of those people have got your medical aids, which allows them access to private healthcare, and by definition, those people that have got access to medical aids and all that is the middle class. And by this time of the year, we can tell you that private healthcare facilities are not as busy as the public healthcare facilities, because these medical aids have run out, they are depleted. Now, we have seen an increase in the usage of the public healthcare facilities, because 86% of the South African population relies on the public healthcare facilities to access healthcare. That is where we have seen, the rise, especially if you look at hospitals which are located in areas that are not far from informal settlements, that are not far from the central business district, the CBD of Johannesburg. You look at, for instance, you look at South Rand, you look at Charlotte Maxeke, Johannesburg Academic Hospital, you look at Barra Hospital, all those healthcare facilities are then facing, a surge in people who are accessing these healthcare facilities because of violence that we see in the main, influenced by the, irresponsible use of alcohol. You find people fight in the township. They follow you up until you are in the hospital, and they would want to finish you off in the hospital. These are things that health workers face on a daily basis. And we rely on the security as well as the law enforcement agencies to assist us in ensuring that there's law and order in our emergency areas, which are commonly known as the casualty area, as well as our community healthcare facilities, because these are clinics that open 24 hours, which before you go to the hospital, in terms of how the healthcare system is organized, you've got to start at the clinic. So we've got these CHCs which people must start at. Even there, we see most people who fight in the township, they follow their victims up to the level that even when they are taken by ambulances, because these attacks are not only isolated inside the healthcare facilities. We've seen a rise in our emergency medical personnel being attacked when they go and pick up patients when they are called. And that is why the approach that has been happening is that our ambulances have been accompanied by police, which is not a desirable situation, because this is a total waste of the public resources. Because you can imagine, I mean, police should be mending other things and dealing with the prevention of crime and other issues that affect them. But in this instance, we have been clear that ambulances cannot go, especially in informal settlements where there's no clear address and so forth. That's where we have seen a rise in the spate of attacks to our emergency medical personnel.
So it must be very worrying for you when you talk about the incidents. And you say this happens on a daily basis. So I'd imagine it's across the country. So how do you prepare your health personnel for these unfortunate incidents? Because if I'm a nurse or if I'm a health practitioner, I'm in a hospital, and I know that these armed crooks or thugs, whatever you'd like to call them, are going to come in and potentially harass or harm us, I'd like to be prepared. What are the conversations that you are having with the personnel? So whether it's at the point of receipt of the acceptance of the individual, is it the security guards that need to be well informed or well prepared, or is it the personnel themselves?
Well, what we have been doing is that we have been unapologetic in our approach in this regard, in that what we have done is that all security officers in the facilities, all security officers in the facility have been engaged that anybody that displays violence in accessing our healthcare facilities should not be allowed into our healthcare facilities. But also, what we have been doing is that engaging management that anybody that attends our healthcare facilities should be accompanied by one person. So there's been circulars to make sure that we limit the access into the healthcare facilities, and we allow at least one relative to accompany the person that has been brought forward. But what we have also been doing is to engage the Department of Health in that what we have, some of the proposals that we have done is to have, stakeholder engagements, because these people that are taking healthcare workers are not coming, are not falling out of the sky, but they are coming from the communities. So what we have been doing as well is to engage community organizations to understand that they should take ownership of the healthcare facilities, because these healthcare facilities do not belong to the health workers, but they belong to the communities. And we have seen positive, responses in certain communities. Unfortunately, in other communities, there's been, that resistance. One of the hotspot areas is that we see is in the south. There we have seen a rise in the spate of attacks in healthcare workers. So, but we continue to engage, because this requires a multidisciplinary approach. It's not an issue of the Department of Health alone. It's not an issue of healthcare workers alone or the trade unions in the health space, but it requires all of us to understand that healthcare workers are not like any other workers. We are providing a constitutionally guaranteed, service that everybody's got the right to access healthcare, and therefore it is always our wish that we make sure that we provide, equitable access to healthcare. But in other instances, unfortunately and regrettably so, we have had to withdraw our members, especially in areas such as Polar Park in Ekurhuleni, where we have seen that health workers have not been protected, where we are not satisfied in terms of the presence of security forces. We then have to withdraw our members, and unfortunately such clinics would not have to operate 24 hours. But in hospitals, at least, what we have also been doing is engaging local police stations to ensure that there's visibility. And they've been doing that. We've been trying to, you know, to do that, to ensure that access to healthcare is no increased. But what is more concerning for me when we talk about the issue of attacks on healthcare workers, it tells you, you know, the moral fiber of society that we have in South Africa. Because in the olden days, even myself, before I became a healthcare worker, you know, the respect that was accorded to healthcare workers and all those things were things that motivated us to join the profession. But as we speak, people don't respect our police, they don't respect our teachers, they don't respect our nurses. And this is something that, as a society, we need to speak about, to say, what do we do to correct this behavior of people who seem to be angry, and their anger is directed at professionals, especially public servants. Because you can go to any public servants, where any public office where people are working, whether it's home affairs and so forth, what we see is the rise in the spate of attacks.
Well, sorry, if you allow me to come in there, Simphiwe. I mean, you raise an important issue, and that's the anger that the general populace, or certainly a large number of South Africans are feeling. And those that wish to show this anger seem to attack any arm of government. So like you say, so whether it's the health workers, it's, whomever it is, that they access the police and so on. And I suppose it's, I mean, that anger is untold when you look at the brazen nature of it, where we've seen on social media the police themselves, who are armed, right, to the hilt, being attacked by these individuals. So in your view, it's obviously something that you've thought about. How was this addressed? I mean, it's not quite the subject matter that we were talking about, but it does impact Denosa and certainly its members.
Yes, it does affect us, because, I mean, if people don't respect police, how are they expect? I mean, police are armed. They've got firearms. And if people don't see police, they don't respect police, when they get to the hospital, obviously their behavior will be worsened, because nurses, doctors, any healthcare worker does not go to work armed. I mean, hospitals and clinics are gun-free zones. So this does concern us. And in fact, that is why we say that all these things, when we look at them, it's a matter of concern. And the political leadership in the country should be concerned, because when we look at this issue, it shows the levels of trust between government and its population. Because the anger is not necessarily directed at the nurses, police, and so forth. The anger is directed at government, and government should be able to say that what is it that we are willing to do to ensure that we address the low levels of trust between ourselves as well as the community. So it shows you that South Africa as a country has got a crisis of leadership, and this crisis has got to be addressed, because when people are not properly led, that's why you will see destructive behavior. But when people are properly led, they know what is it that they do, what is the agenda of the country. So as we see it, we don't have a clear agenda of the country. I mean, we'll talk about the national health insurance. If we are saying that we are moving towards the national health insurance, which as Denosa we support, and we think that the national health insurance is what is going to assist us to ensure that we bridge the gap between the poor and the rich as far as accessing healthcare. But be that as it may, the issue still goes back to the level of trust, because many people are angry because of the levels of corruption in this country. And these are things that should be addressed, because generally South Africans feel that you know, their concerns are not taken serious by government. And this is something that must be addressed, and we hope that even South Africans will be able to address this issue as we move towards 2024. Where they'll be able to express themselves as far as their preference is concerned when it comes to electing government. But ourselves as health workers, we will continue, because we understand that we took an oath. We'll continue to ensure that access to healthcare is not compromised, albeit the fact that the public always attacks health workers. And I want to take this opportunity and call on the public, community leaders, NGOs, and on all progressive forces within the society to say that everybody must take ownership of healthcare, and everybody must make it their business to ensure that healthcare workers are protected, especially during this time of the year. I mean, today is the last day of 2023. We know that as the sun sets, and as we go towards midnight, we will have many incidences. But we are confident that our healthcare workers are ready to deal with whatever situation that will come in our emergency areas. As I'm talking to you, I just arrived from Limpopo, where we met, we're unfortunately burying one of the worker leaders, and we came straight here. But as we're liaising, with our structures, we are quite confident that the health workers are ready for tonight and any eventuality that will happen. And as I was saying, that we call on the community to protect healthcare workers, because it's undesirable to be attacked, especially when you want to help people, but the very same people that you are helping are attacking you. That is not something that is motivating.
No, it's not. There have been some issues, though, Simphiwe, if we go back to 2023, where the public has expressed dissatisfaction with the performance of healthcare workers. In the Northwest several months ago, I think there was the issue of newborns being put in cardboard boxes, and there was an absolute outcry. There's also the unfortunate incident of the young girl, I think, who was 15 years old, who was abused, went to a health facility and was not attended to, was denied service, I think, only a few weeks ago. And then there are multiple reports of individuals, particularly those that are members of the queer community, right, or those that go in to collect drugs such as ARVs, for instance, and how they're called out or chastised by health personnel. What is your reaction to those issues?
Well, as the Democratic Nursing Organization, let me express our view on the Northwest incident. One, we have condemned the Department of Health and how it has reacted on that incident, because if you go deeper and look at the issues, the nurses there were simply improvising, against the lack of resources. And the nurses, because if you go in there, and even that report that is investigating what happened in Northwest is something that we are eagerly waiting for, because our view is that our nurses are innocent in that regard of the babies in Northwest. In fact, that is a failure of government in Northwest to ensure that there's availability of tools of trade, resources to ensure that we look after the babies. Because if you go to the Northwest incident, you'll find that incubators were finished and nurses had to improvise to ensure that they keep the babies alive. But what then happened is that we saw political posturing from the MEC of Health in Northwest, which we condemn, by the way, without making any apology. We say that the MEC of Health, MEC Sambata, was wrong there in Northwest. So it's something that we stand with our members. What happened in Northwest, it was nurses showing, they were showing that they are actually committed to the healthcare service. But on other issues, I mean, if we look at the issue of collection of ARVs, I think many will agree that if you look back, there's many strides which have been registered as far as ensuring that people living with HIV, TB and so forth live a normal life. The life expectancy there now is 70 years old. In fact, a person that has got HIV and AIDS actually has got a better quality of life than any other person that faces these other chronic illnesses. For instance, if you ask me, if I were to choose between HIV and AIDS, as well as maybe diabetes or hypertension, I would go for HIV and AIDS, because I know that significant progress has been made as far as the treatment there. And we see that people who are HIV positive live quality of life, they live up to the age of 70 years. We've got the largest ARV program in the world as South Africa, and this is because of nurses who went to train to what we call NIMART, which nurses are initiating patients on ARVs and so forth. So nurses in that regard have done well, but we're also exploring the use of technology in that regard, in that patients that collect ARVs and so forth, there's a program which we call CCMDD, which, you don't have to see a healthcare professional. You get an SMS on your phone, you know when to collect your medication and so forth. These are strides which have been made by nurses because of research. So as far as HIV prevention is concerned, we applaud our healthcare workers. And yes, we'll concede to the fact that at times there are unfortunate incidents like the one that we are mentioning. And as an organization that has got two wings, we've got a professional wing, we've got a labor wing as Denosa. we'll always ensure that we uphold the highest standards of the profession. And of course, without making any apology, we'll condemn any unprofessional behavior to which we condemn in this regard. And we always ensure that if our members are found in an incident that is unprofessional, as an organization, we make sure that we rehabilitate those members, we teach them, so that they understand that they took an oath. They also understand that the profession has got values that need to be upheld. So we know that the health system is not perfect, but one thing that we must give South Africans, which we must applaud, is that they are dedicated men and women who work in the public health system, serving the 86% of the population. These men and women have got options to go overseas, they've got options to work in the private sector, but they have chosen to serve the public sector. And we appreciate that, and that is why that from where we are sitting as Denosa, we'll appreciate those people, and we commend them when we say that they must do more, especially now that both houses of parliament have adopted the NHI, because our position is an organization that will support NHI, and we hope that NHI will be passed through so that all South Africans can get an equal chance of accessing healthcare. So that's where we stand. We'll always condemn, like I was saying. Where there's unprofessionalism, we'll not make any apology to condemn such. But from where we're sitting, we think that if you look at the Sustainable Development Goals, for instance, achieving good health outcomes, Sustainable Goal number 23, which tells you that we want to achieve good health outcomes. We want to ensure that 90% of the population is tested, 90% is that test positive, is enrolled on ART treatment, and that 90% is virally suppressed. We think that we're in the right direction to achieving that. And we must give applaud ways to our doctors and nurses who continue to work hard to ensure that the issue of HIV is no longer a pandemic in this country. And from where we are, we're confident that all our public healthcare workers are on the right track to ensuring that the public healthcare system, remains strong and will not fall apart.
Simphiwe, that's where we're going to leave it. Appreciate your time. Thanks so much for coming onto the show, and wish you all the best in 2024.